And discuss action and possible approval of the minutes from August 8th.
Move to approve.
Is there a second?
Second.
Any further discussion about everything that's in there? Hearing none, all in favor of the minutes as presented indicate by saying aye.
Aye.
Aye, opposed, like sign, motion carries. Thank you very much. Discussion and possible action on ambulance rate increases. Who's gonna do that? Brenda? Okay.
Good morning. I sent out a memo, and in the memo, I compared the rates of St. Croix EMS with River Falls, Baldwin, New Richmond, and Amory for 2017, and did the average, and then we also pulled Woodbury and Cottage Grove, Minnesota. It's important to note that St. Croix EMS and New Richmond both increased their rates in 2017 by 3%. And then Baldwin increased rates by 100, and then River Falls did not increase rates at this point. So from 16 to 17, they didn't increase rates, but we know that they're going through a study at this point. So we would assume that that would be part of that study.
Okay.
The third page in the report is just the payer mix trend. It's something that you've seen in the past. It's just important to remember that as Medicare continues to increase, our payment mix, or the amount of payments goes down. 15, we received for all payer types, 580 per call, and that looks like that's going to be consistent for 2016 also. That's what I've seen. And then on the fourth page is the billable runs that we're using now for the 18 budget. And if we go actually from right to left, the first column should actually say 2013. It was 1,489 runs. And for the 18 budget, we're using a 10% run volume increase, and so it'd be 1,744 runs. When we did the survey, Brenda and I looked at the results, and the one place where we weren't average, we were below average, was in the specialized care transport. So for 2018, we are recommending to bump that more than 3, 5, or 8%, depending on what increase we go with. And then the last line on that page is projecting out how much additional cash that we will bring in at each of those increases. So at 3% with a 10% run volume increase, we'd bring in $21,000. At 5%, we'd bring in $31,000, and then 8%, $47,000.
Does it affect our per capita rate at all?
Every $27,000 approximately that you would lower your expenditures or increase your revenue, you could talk about lowering per capita.
By what? 0.5% or $1?
$1
$1?
per capita. Remember, the goal of the fund is $500,000 in cash.
Yep.
And so you have to kind of look at that. Right
Yeah.
now, with the preliminary budget numbers that Brandon and I are looking at, we're less than $500,000.
Why?
Because we have not identified additional revenues. Actually, what I have in there right now is a 3% increase in rates, so we could add that in there. And we haven't identified any other additional revenues or any expenditure reductions.
So if you increased it to 8, all you might do is get your cash flow up to $500,000 on hand and not change the per capita rate?
That would be a discussion for the commission
Wow.
and for
But
the
I,
council.
by the numbers, you
Yep.
know what I mean? Okay.
Yeah,
I'm trying to understand what your numbers mean.
correct.
Okay. Any other, is that it for that?
I have a question. So when I look at these numbers, Brenda, the 3% increase also assumes a 10% run increase?
Correct.
Okay, so I just have a question of where that 10% came from, and I don't know if that's for Brandon or yourself, but I look at our billable runs, the chart that you gave us here, okay? And back in 2013, our billable runs were 1489. We're projecting, well, not projecting, yeah, we're projecting for this year 1643. So if I go back to 2013, which is 1, 2, 3, 4 years, our run increase in 4 years is less than 10% total. If I go back to 2014, it's less than 2%.
Correct.
So I'm wondering, how did we get, worst case scenario, if I looking at the worst case compared to now, our run rate is increase is about 2.5%, right? So how do we go from 2 to 2.5% to 10%?
And I struggle with that too.
Okay.
As we were, in January, when we started saying, well, maybe we're not going to go with the contract with the hospital, we started to have a lot of discussions with Brandon. And because of staffing, we are turning away those interfacility transports. And he actually feels that that's 15%. But I feel that because of the trend, we need to bring that down. So I brought it down to 10%. But it's based on the interfacility runs that we are turning away right now because of staffing issues. So we feel that with having 2 paramedics and 2 EMTs at the station, that we're not going to have to turn those runs away. So it's based on that.
All right, so if we do more interfacility transports, then we'll have fewer ambulances here in Hudson, basically. I mean, they'll be sending.
They'll be on
okay.
the road.
So our old plan is we had the 2 ambulances here more often. Our new plan is we'd be doing more interfacility transports, so we'd be down to 1 ambulance here, and then we'd do mutual aid backup or something like that.
Which is, go ahead,
We
Brandon.
still utilize the current system of the all-call, utilizing staff in town.
Is
You're
that
still
part of
gonna-
our budget then?
Yeah,
You're still gonna use a 3rd ambulance?
yeah, it's in there.
Okay.
So that, the new budget projections show us not only with 2 ambulances fully staffed, but another ambulance on all-call?
We have $9,000
Right.
in there for all calls. So we can go back and figure out how many all calls that is
Yeah,
to make sure that the commission is comfortable with that number.
okay.
Just putting it together, and it's probably a question for you and to work with, Brenda, is how much were we losing when we turned away those interfacility transfers?
It was over
Dollar
100
amount.
calls, roughly 50 to 60,000.
Okay,
It
okay,
was-
so 9,000 is a good trade. Okay, I just wanted to understand that.
I have a question. 2014, 1,609 runs, and then it declined. 2015 went back up a little in 2016. Were those declines solely because of the lack, or not being able to cover the interfacility transfers?
Part of it was staffing and part of it was that credentialing issue that we had that we resolved in 14, end of 14.
Beginning of 16, correct? The certification?
Yes, beginning of 16, actually, yeah.
And you're keeping a record of how many interfacility runs that you have to turn down?
We're doing the best we can. It's kind of hard to track because we don't always get the phone call right away. Sometimes they'll just automatically call another service. If we go in and take a transfer and then they have a second one, they don't always call us right away. Sometimes they'll just call the next.
So the number of runs that you just said, the 100, is not based on any data?
That's based on what we were able to calculate. There's probably more than that, based on the way the system currently works. It's up to the individual making the phone call for the transfer on who they call.
Were you able to get that information on the number of runs between 10 PM and 6 AM that we discussed at the last meeting?
I have not yet. They're actually working on getting us the breakdown.
You haven't got that?
No. Part of that's with our data management service. We have new software, so.
You don't separately keep track of that?
No,
Why not?
just something that we haven't traditionally done. In the old system, we could break that out. In the new system, the reports haven't been built yet.
If you don't keep track of the number of runs, how can you justify having a second ambulance during that time?
Because we're required to be able to handle the interfacility as part of our plan with the state.
I'm sorry?
It's part of our plan with the state. We have to have 2 on to do any interfacility at all.
How long has that been in place?
Since we went paramedic in 2004?
Okay. So you're saying you have to have 2 ALS ambulances 24/7?
Correct.
But you don't have any numbers to justify if you really need one from 10 PM to 6 AM?
You have to have a second.
You have to have it. It's part of the.
I know, but you can get a waiver.
Pardon?
Can you not get a waiver?
Not that I'm aware of.
Have you looked into that?
No, because it's always been just in the plan, it flat out says that to provide that service.
What we
you have
need
have
to
it.
know is how many runs we're doing from 10 PM to 6 AM to see how much it's costing our service to do that, to see if we can change it. Because that's a big, I don't think that, well, I've said enough.
Well, no, I
we can
think,
look into
I
it.
think you're on a good track there, Tom. I mean, because right now, Brandon, I mean, under our service as it's defined right now, we don't have those people here full-time. They're just on call, correct?
Correct.
So obviously, having people on call must be fulfilling our contract. So under our new plan, we could have a full-time ambulance here in the evening and have another ambulance on call and fulfill our contract. If we couldn't, that means we're out of
We're
compliance
out of the
before.
revenue, yep. If we can't do it, then we're just out of the revenue.
What's that?
If we can't do it, we're out of revenue. We're not able to do those transfers on.
Right, so
revenue
this,
loss.
so that comes down to how many interfacility transfers are done in the middle of the night, right?
Yeah,
Right.
And you don't have warning on when that's gonna happen, and I assume.
right.
Somebody, that isn't a scheduled transfer, they need to be transferred, correct?
Correct. We don't traditionally do many scheduled transfers at all.
I understand all of these things are unscheduled. I mean, if they were scheduled, we'd know that we need to have ambulances.
No, the only reason I'm asking that is you can't bring the people in time to do the transfer as far as the hospital's concerned, is that correct?
Correct. Usually they want them out there rather quickly.
But we don't have any numbers that tells us anything about that, how many there are.
Would it matter?
Of course.
If you lose it, it doesn't matter?
No, it matters how much we're spending in order to cover that period.
Okay.
Yeah.
So you just want to know what you're going to lose? if you-
Yeah, well,
if you find out
that's,
what
yeah,
you're
that's right.
Versus what you,
Okay.
yeah,
Okay, I get it.
saving and staffing costs, right?
Okay.
So if we have these increases, the bottom line is how much will the revenue be increased?
Correct. So that, at some point, you could increase your rates so much that your write-offs are going to go up because people are going to look at the bill and say, I just can't afford it. Because the people that have the private pay insurance or do not have insurance, those are the ones that are going to see these rates. Your Medicare and your Medicaid, as you know, those are all write-offs, and so those citizens or patients aren't going to see these rates. It's your private pay insurance.
Is that an assumption or a fact?
That's a fact.
You're saying that if I have Medicare and my copay is higher, that I'm gonna not pay it?
Nope, that's
That's
not
a
what I,
fact?
nope, what I said is it
You said
doesn't matter.
Medicaid and Medicare.
I said it doesn't matter for Medicare and Medicaid patients because they have their copay, and then we are required to write off the difference.
On
so-
Medicaid, not Medicare, correct? You can still bill a patient on Medicare,
We
correct?
cannot bill the patient on Medicare. We can only bill them for their copay. It's about $70. It's less than 100.
That's all they'll allow? Okay.
Does that make,
No, it doesn't make sense.
Yeah. Well, it's low. I mean, I'm not on Medicare now with supplemental insurance. It's very low, the copay.
and that started in 2003, where ambulance services across the nation were required to
Do
take
you
what's
have
called
any
mandatory assignment.
Do you have any idea why the state of Wisconsin is so much lower than Minnesota?
I do not.
Okay.
Although we do believe it, we talk about Obamacare and this, what the state of Wisconsin decided to do versus the state of Minnesota, but we now know that the state of Minnesota is going to start to feel those effects also.
Right.
So we would think we would not feel the effects as much.
Brenda, since Medicare, it doesn't matter if we charge them $5,000, we're only
Doesn't
going to get paid
matter.
a certain amount. So over time, that percentage of runs is increasing, correct? Do we have, Brandon, do you have a projection, like 3 years from now, what percentage of our mix is going to be Medicare based on the current trends?
We don't.
We don't, it's going up. Let's see if I have it.
Well, you're going to have a tough time with that, and part of the reason for it is you could get it off of the numbers of aging, but you guys keep adding nursing homes to your municipal facilities in the city of Hudson. So you're adding 2 new facilities up by the dog track. That increases your numbers of potential Medicare people that are going to be transported in the next 3 years.
I understand. That's why I'm asking if we know, because that's going to affect, in the long term, what we get back in revenue.
Absolutely, well, and on our payer mix trend graph, I mean, we do know what happened between 2013 and 2016. We were at 44%, and now we're up to 51%.
Right.
So if you look at your charts you've got here, our Medicare payments, they're increasing by 15% over the last 3 years, and our run rate has only increased by less than 2% over the last 3 years. So that's a pretty telling statistic. Is if you look at 2014, which is where your Medicare payments go back to, we had 1,609 runs, and now we have 1,643, which is an increase of about 2% in total runs, versus our Medicare payments went from 44% to 51%, which is about a 15% increase. So our Medicare payments are going up much faster than our run rates.
Our number of patients that are Medicare are going up. That's, so actually, on a Medicare run, we're only getting $423. Yep.
Right, that's what I'm saying. I think that was Tom's question in terms of what does this trend line look like? And the percentage of people that we're picking up that are on Medicare is going like this, and our number of runs is going like this as a trend. So this gap is getting bigger and bigger,
True.
over the last 3 years anyway.
Well, and it's going to get significantly worse.
Right,
as
that's
our
what
costs
Tom-
go
that's- I
up.
think that's what Tom's
Because if
question
you
was,
look at the
right.
dollar amount,
Right.
we get 423, 229, 265. I don't know what a run cost is today, but I'll bet we ain't going out for less than $400.
It's averaging about 650.
Yeah, so we're losing money, Jim.
If I could interject, sorry. This is some information. I contacted the League of Municipalities to ask them statewide what they knew was going on. And in 2015, the city of Milwaukee put out a proposal. I'll see if I can shorthand this thing. I've got 3 pages here that I can hardly understand, but basically, the state can request additional funds to pay for their Medicaid runs, to help pay for Medicaid runs. The states that have it are getting approximately 50% of their loss covered, so which would be significant. for us, and any, $200 to $400 perhaps per run. But the state has to do it, and at the time, and I don't have all the details as to why, but the state chose to not go ahead and try to obtain these additional funds. These are federal funds, so it's you're getting into, I'm going after federal money that's out there, but is that the right thing to do type of thing? So that may be why Wisconsin didn't move forward. But I've submitted this to Sheila Harsdorf's office, asking them to look at this and see what was the background on this, what happened, is this a possibility? Because across the state, it's a huge issue.
It is. Nationwide it is.
Yeah.
It's not just.
So it's an opportunity, and I can email this. I've got about a string of about 8 emails, but I can detach the report, or this report, and send it to you guys. Now, is that something that would be
Yeah,
worthwhile?
but you'll want to have Joanne send it out to us.
Okay.
Yeah.
Now,
Jim,
the question is, would we like the state to pursue this or not?
Anything at this point.
Jim, is there any reasonable expectation at this point that the state is going to cover some more of this cost?
No, I'm not haven't talked to anybody about that. This is just something that was a proposal that was out there and was possible to make happen. So this is not the state providing any money. This is the state setting up the program and applying for the program and getting it approved. And then the money goes out to the different EMS that are qualified, and I believe that we will qualify under what little I can see here.
And this is Medicaid, not Medicare?
It's Medicaid.
Okay.
Yeah.
So, and you're saying it might be as much as $200?
Oh, easily.
What's
Yeah.
that?
Yeah.
So-
200 to 400, depending on the type of call that it was, whether it was BLS or ALS. At least based on this report. So it's a minimum of it looks like it'd be a minimum of $200, because that's what we lose, about 4, perhaps,
Roughly, yeah.
4 or 450 on a call, on a basic call.
So if the state set up that program and we assume $200, that could bring about another 30,000 into the,
Right.
'cause I took 9%, multiplied by our run rate now, we probably about 150 Medicaid runs, which ends up about 30 grand. Right. So that's,
So 1%. That's
that's,
$1 on our per capita.
right.
It's worth it.
So, yeah, but like Jim says, first of all, the state's got to apply for the program, set the program up, get
But
the
it's worth
funding.
asking for.
Right, oh,
I agree.
absolutely. So
I agree.
it's about 30,000.
It's out there, people are using it,
Other states?
yeah,
Uh-huh.
so.
Does Minnesota use it, do you know, Jim?
They're not listed as one of the
Okay,
states,
yeah.
but this is not necessarily an inclusive report.
Uh-huh,
It's
right.
started back in 2015, I think, so.
What are the qualifications, to qualify for the money? I mean, if all of a sudden they set a program up, you want every ambulance service in the state go after that money too?
Oh, no
Is
doubt,
there an unlimited amount of money? I mean,
yes.
with the federal
The
government?
way they described
They
it,
can
yeah,
print
it's,
it, of course they can.
it's a program that has, Medicaid funds are not
My guess
limited on
is
the
it
federal
has to
basis.
be somewhat funded by the state, or they would have never turned it down. Do you know what I mean, Jim?
I
It doesn't
can't read-
imply
I can't
that,
read
but it doesn't make any sense that they would have turned Milwaukee down on it if it was strictly federal funded. You know what I mean?
Have-
Logic would tell me that,
Has the state done that?
I don't know,
Yeah.
if they didn't.
Yeah, they've turned down federal funds, so.
Well, not to,
Well,
yeah,
unless there was,
because
there's gotta be
But-
strings attached to it.
Strings are.
they turned down federal funds so they didn't have to expand other programs, right? So that's, I think that's what Tim's question
Yeah, there's
is.
strings
So
attached
if
to
you
it. some
take this, what do you do? Yeah, we all know we have a governor who's not been a big fan of subsidized government medical programs, so. Yeah, and he has turned down money, but I think it's partly because if you take the money, then you've got to do other things.
I agree.
Yeah, this is just what I have is the
Right.
report of the program that was submitted.
Yeah.
I don't have all the background as to why it wasn't passed.
Okay.
I've seen some emails that hint at things, but that's not appropriate to.
Yeah.
Could you get the emails to Joanne and she'll email them out to us so we can read through it?
Yeah, I'll email, I don't think I'll email or send you all the emails. That's probably inappropriate, but I'll send the report.
Oh, a report, that'll work.
Yeah.
Scan it in or something?
Yeah, here's their program.
Okay,
Yeah.
that works.
So,
Thank you.
Jim, just so I understand, so the steps you've taken already, you've contacted Sheila and just questioned her why we're not partaking
Right.
in this
I asked
program?
them to look at this and say, what was
Okay.
what was the rationale, or
Right.
can we move forward? We could really use the money.
Sure.
And we're losing money every run.
About 30,000, yeah.
Yeah, 30,000 is a good number, too.
Oh, yeah, all right.
I've done that.
Thanks.
And as you say, it's an increasing issue.
Yeah,
Right.
it is. Other questions?
I think I have a question for Brenda. Brenda, you got lots of great statistics here about paramedics and what people are paying paramedics. Where am I missing here on EMTs in terms of what sheet is that in terms of what are communities paying their EMTs?
I was concentrating on paramedics, and so I can, if you want, get the EMT information for next meeting.
Oh, okay.
Yep,
Okay.
absolutely. Would the commission like that?
Do you want to, let's
Are we
make sure
done?
we're done with one before we move. Are we done with the possible action on the rate increase? No, we're not. We need to make a recommendation one way or the other.
Right. Right, well, you answered my
Any-
question.
Yeah, we're going to need to wait on that one because that's a separate line item.
Yeah.
That's number 3. Is there
That's
any
what we're
other-
on, right? Number 3, right?
No, we're on 8. Discuss possible action on ambulance
Oh,
rate.
I see. I thought when Brenda
Oh.
went through this, she covered all of her sheets here.
No,
Okay.
not yet.
And just to remind the commission, we did a 3% rate increase last year. So if we want to stick with the plan, maybe it should be 3 or 5%.
Frankly, I think we
8%
ought to
is.
go to 8.
Okay.
Brenda, is there any downside to increasing our rates?
At some point, people will look at their bill, the private pay and the insurance that has the high deductible plan and say that that's a bill that's just too high, I'm gonna not pay that. So that's,
Have
We
we
don't-
experienced that yet?
we did. We increased the rates in 2014 to 8%. And if you look at the amount paid by insurance and the amount paid by patient, it did decrease by 2% those years when that happened.
So you still got 6. Okay.
Sure.
Yep. Thank you.
Yep.
I get it. Okay.
So, I have one more question here. In terms of last month, we talked about having an out-of-service rate. Where is
I
that
don't
reflected here?
have that in there. I talked to Brandon Moore and I talked to Doug Johnson and Eric Kiefer even from our billing company, and they're stating that, that's something that some services do. They're not seeing the revenue generated from it, so they all recommended against it.
Really?
All right, but that was our strategy to try and get a community to pay their fair share here?
It
of the
is, yep,
ambulance?
and so if you want to do it for that purpose, do it for that purpose. You're probably not going to see a big rate
Right.
revenue stream. Yes,
Why,
if you want to do it.
did they explain why we don't get revenue increase from it? Is it they just won't pay that amount?
Gets to be a higher bill, and so people will say, I can't afford that.
People, insurance
Patients.
companies are non-paying people,
But
non-insurance.
without insurance.
Right, but that's a 10%, right? What about the other 90% we're paying?
That doesn't mean they're, don't have insurance. It means, this is, how many out-of-service ambulance runs did we have last year?
In the area you're talking about?
Yes.
40.
40. So we had 40 runs in an area that,
4 of them didn't have insurance, right?
so most of them had insurance, right, of the 40? I assume?
I think the payer mix is pretty much the same there as it is here, so.
Well, I mean, if you look at communities outside of the city, that's not true. I mean, in Troy, it's a very much higher percentage of full pay, right? In this area, would that be true too? Is the community younger and,
The area that we serve is a mix of
Sorry?
it's a mix of the aged
is it?
population,
Okay,
yeah.
all right. Okay, so that's, last month, we were just talking about how could we incent this community to help offset the cost of the service? And
That's why we're trying to understand why it wouldn't, if we would have gotten $30,000 from them, why can't we bill the people that we're picking up that aren't paying that?
We can.
But you're
It's
saying
probably
we
not
wouldn't
gonna
get
be-
that money.
We're probably not gonna get any additional cash, but what it will prompt is phone calls from those patients to the service, to the billing company, why is my bill so high? And then the response can be, because your community is not contributing to the ambulance.
Then I think we ought to
So
do it
if
for
that
that
is
reason.
what you want to do, that's fine.
Yeah, see, I think, what other strategy do we have?
That's fine, yep.
Yeah, because they stonewalled me in Sue when we went down there twice. Didn't even want to talk. We're paying our money to New Richmond and we're not gonna give you a dime.
Brenda, bottom line, given our payer mix and anticipated runs, what will we net if we increase the rates at the proposed level?
At the 3, 5, or 8%?
Well, the 8% first.
47,000.
720, it's at the bottom of that page.
Which page?
Fifth page, is it? This one, the last page.
Oh, I got it.
And it's 31,290 and 21,290.
So that's an 8% increase in what we're charging and a 10% run increase.
Correct.
Okay, so there's both going on.
Well, is there any reason not to go for the 8%?
That's my reaction. Does anybody else feel? Because we might lose a little bit, but who knows what it is until after you do it.
Yeah.
Well,
The insurance figures they're not gonna pay it all. What is it? We won't know until after we submit it.
And the patients without insurance, we don't give a shit about that.
Well, no, they'll negotiate with us. Some of them do. To reduce payment.
Most of the
I'll
time it's
move
a
that we
payment
increase
plan.
rates by 8%.
What was that, Fran?
A lot of times we do payment plans, so it just spreads out the payments, but
Okay, I'll second that, Tom. Motion been made and seconded to increase our rate in 2018 by 8%. Is there any further discussion?
Yeah, I guess the only thing I think the note should reflect is the fact that this spreadsheet that says we're gonna bring in an extra 47,000 is dependent on run rates going up by 10%, and ask Brandon to track that and let us know on a quarterly basis or something whether we're anywhere near that.
Well, we'll know.
Well, but I mean, you know, in terms of our funding for this.
You'll
because-
know that,
Because
too.
I mean, we're saying that this will drive us down by $1.50, right? Per capita. $30,000 takes us down $1, right? So 47,000,
in,
No, well, two things. Gotta remember, you don't have your budget at $500,000 in cash. You budgeted $1 less this year
right.
because we were gonna take cash out of the reserve, which we still got in the budget
Okay,
problem.
let me rephrase this. This, as we do budgeting, lets us assume that we can collect $1.50 less per person. Because we're gonna put this in our budget now, that we're gonna collect an extra 47,000, right?
correct.
Yeah.
But I want
So
her
when
to
we
be-
do our budgeting, and we say, how are we gonna come up with a bottom line of 0 or whatever, this assumption here will allow us to about cut our per capita rate by $1.50.
If you left everything straight, I agree, but I'd want to budget at $500,000
Yeah,
And,
cash
and
flow.
right.
Ray, do you mean from the $14 or from the $19.25 per
No,
capita?
just putting this $47,000 in our budget. This will be another $47,000 that'll be in our budget projections for next year,
Correct.
which will, when we come to the bottom line and then do our division, will allow us to take $1.50 off our per capita rates, whatever it is.
If everything else stays the
Whatever it is,
same,
yeah.
but we do know that we have additional staffing needs for next year. I don't want you to
Right.
think that we're gonna lower.
No, I'm not saying that we're lowering our rates. I'm not saying we're gonna lower our per capita. If we get to the end of our budgeting, it says we need $16 per capita. If we hadn't put this 47 in there, we would need 17.5.
Absolutely.
Right, that's all I'm saying, is that this assumption here.
Okay.
Just so we all understand, brings whatever we're doing down by $1.50.
Yes,
Okay,
Thank you. Yep.
all right.
If you have a 10% increase in runs.
correct.
What if we don't have that?
Well, then that's why I'm saying, we just
Then you
need to
don't.
track it and understand our assumptions valid, that's all.
But we
Brenda,
got
do
this.
you think it's reasonable for us to assume that we're gonna get 47,720?
I do.
Okay.
I was conservative. I mean, if our Medicare percentage goes way, much higher than it is now, then no, but when I looked at it, I was conservative with the numbers, so yes, I do anticipate it.
And in fact, if we get more transfers than what we think you might at the 10%, then we may actually get more revenue.
Correct.
So I agree, that's probably conservative. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, like sign. Motion's carried, thank you.
Did we want an out-of-service rate? There was some discussion.
I believe we should. But, and I suppose I should be the one to talk to that, because Sue Warren and I went down by myself, it came back to the commission. We talked, Kim maybe was the chief at the time, we talked at the commission. Sue Warren agreed to come down with me. We went back down and told them, look, you either need to be part of the per capita cost for this, or we're gonna have to let you know that we can't, if we've got busy ambulances, we're gonna turn down a call to come to you, even though you're in our service area. And they said, fine. We'll get somebody else, and our people will have to wait till we get there. And it was like, really? You're okay with that? Yep, we're okay with that. That's why I said there just wasn't any, well, we all know what levy limits are, and that's what they were up against. And that's gotta be 4 years ago, I suppose, 3-4 years at least. So,
Would it be okay if Brandon and I worked through it and brought a recommendation back for the next meeting?
Yes.
On out-of-service rate? Okay.
yes, please. So we'll put it on the agenda for next meeting. Discussion, let's go to 3 then, possible discussion on short-term plans, stipend increases, and shift differential.
All right, so what we have in there for the short-term plan, right now we're having some staffing issues. So the short-term plan is to provide some stipend increases, some night and weekend differentials to try to make those positions more attractive and get the coverage in there. Brenda did provide 2 options in the packet as far as what those additional payments would look like and how it would affect us. With option 1 being about $3,500 for the rest of the year. Option 2 is $1,800, $1,850. Can you give the kind of breakdown, Brenda?
Brandon is seeing difficulty, first of all, in paramedics in getting them to fill the nighttime shifts. And so he asked for a pay differential. And I'm recommending 20 cents per hour. And the reason that we're doing 20 cents per hour is there is the police union that has a pay differential already in their contract, and so we want to be equitable with that contract. And then EMTs, Brendan had come in with $7.50 per shift and $12.50 per shift on weekends. I've lowered that just to be a little bit more equitable with the paramedics, what we can offer them. And so I've got $3 per shift weekdays and $6 per shift on weekends.
Are we having problems finding and retaining EMTs?
Yeah, we're having trouble filling the schedule right now.
Not retaining people, filling the schedule.
Right.
There's a difference, right?
How many EMTs are active?
We have roughly, what, 8 that are filling shifts on a regular basis? 8 to 10 filling shifts on a regular basis.
What's our total?
Total, we have 24.
And how many did we have a year ago?
About the same, roughly 24.
What do you require to maintain, to be active with St. Croix EMS?
It's 24 hours per month is their requirement.
Brenda, how do these proposals fit with the increases in option 3? That
The EMT portion is fine, either option. It will still be less than what we'd be offering January 1st to those EMTs. Paramedics, we do not have a shift differential in the budget for 2018, and so that would be a concern of are we confident that we want to keep going with that pay differential? If not, then we're actually going to be going back down to a lower pay for them.
Are we paying overtime today?
Yes.
Is that anywhere in these two options?
Not in these.
Will you eliminate the overtime by doing this?
We won't eliminate it. We can decrease it a little, but not eliminate.
So, did you just say, Brenda, that if we do these increases, the problem is next year's budget, if we continue it for a full year, can we do that?
Correct, for the paramedics, because of the shift differential. The commission has to be comfortable that that's something that they think that we need to do, continue going forward to fill those shifts. And if we start doing it for the paramedics, then January 1st, are we going to need to do it for EMTs?
So the issue might be we increase these rates now, and then January 1st, we have to say we don't have the money to continue it?
We would have to look at
You would
finding
need to
out,
change
figuring
your
out where
budget to
we would
do
need to
that.
change the budget to reflect it, and so then we go to the per capita discussion again, with how much is it per capita.
Brandon, I assume you wouldn't ask for these unless you had some idea that it's going to make a difference.
Correct. When asking some of the reasoning for not being able to pick up the shifts, wage was one of the issues that was brought up.
From the employees?
Yes,
And do they think they'll take more shifts by doing this?
that's the assumption, yes.
No. Did they say they would, is my question.
Not directly, they just said that they're not making enough.
Yeah, you know, Brandon, my question there, maybe I'm misreading the sheets that Brenda gave us, but we're talking about our paramedics not making enough and going across the river. You know, I'm looking at these sheets here, and it shows our full-time paramedics are paid between $19.49 an hour and $20.03. In River Falls, they're getting between $14 and $14.47. So we're paying about, $5 to $6 an hour more. Why aren't River Falls paramedics flocking to us? I mean, we're paying a third more than River Falls service. Why aren't those paramedics coming here?
I honestly couldn't tell you. I don't know.
Well, and that's what troubles me when we talk about giving people, and going back to what Tim says, you know, we talk about giving, and I have no problem with night stipends. I mean, I wouldn't want to work a night shift, and it's hard work. So night stipends, I understand. When we're talking about it being 20 cents, and our differential is already $5 more than our, I mean, I think of River Falls as being our competing service, right? I mean,
For
we're
you.
both right in the river.
For you.
Well, but I mean, New Richmond's,
They're
New
not-
Richmond's farther away.
They're not on the river.
Yeah.
They're a long
Well,
way
okay.
from
But
Prescott.
when you think of, who's our closest service, right? River Falls. They're about 10 miles away. New Richmond is probably what?
10.
10.
10, 15, yeah, right. So, well, and we can, you know, and we can look at them. They're at $17 an hour, New Richmond. So we're at $19.49, so we're paying $2.50 an hour more. So I look at this and just say, is 20 cents an hour the difference here, or are we missing something? Because we're paying $2.50 an hour more than New Richmond. We're paying $4 more than Baldwin, and $5.50 more than River Falls. So you'd think that if 20 cents was the difference, these paramedics would just be coming and saying, I want to work in Hudson.
Right. And what they've been looking at, though, is the bottom lines there, the Minnesota wages. And that's where we're getting the majority of our people are coming from services over there, where they've been getting those and expect to continue to receive that.
I can, I guess I can understand that if we compare ourselves to, you know, to Woodbury or whatever. I know, what does Lakeview pay?
I don't know what their pay is right now. I know the ones that we have on here.
No scuttlebutt from people who've gone and applied and said this is the kind of wage structure they have, or no?
25 to 26 an hour to start.
What's that?
25 to 26 an hour to start.
Okay, so we have a program where we're paying $20 an hour, and Lakeview started people at $25 to $26 an hour. And people in the service didn't like that. I mean, that their wages would have gone up $5 to $6 an hour and wanted to stay as a municipal service. I don't understand. Somehow 20 cents an hour doesn't seem like it motivates. I mean, if you were concerned about money, Health Partners or Lakeview was going to take all of our paramedics and basically give them a 25% raise, right?
Right.
Right, okay. Now we're talking about giving people a 20% raise, and that's going to motivate them to come to our service. Even though we're paying $2.50 to $5 more than our competing communities. I don't know,
It's a valid question.
does anybody understand the logic there? I mean,
Well, they're bypassing Hudson to go across the river, if you're talking about going from probably River Falls or New Richmond, you know, I mean, it's,
Is that,
but
is
you
that
could come
fact or,
from-
is that, wait a second, is that fact or opinion? Because I want to deal with facts.
Look at the annual salaries though, because of the difference in hours that people work.
But what we're talking about is going to full-time people that are on staff, right? 48 hours a week.
Right.
So we're talking about taking people who are working much less hours here and upping their hours in our new system, right? So they'd be working a minimum of 48 hours a week, correct?
Correct.
Correct, okay. So we can't take this chart and look at it. We gotta say, okay, you know, you've got River Falls who's working their people 56 hours a week, right? We gotta say, okay, now we're going to work our people 48 hours a week. So New Richmond, or River Falls, under this plan, as it exists today with our existing wages, if you work for River Falls, you'd work 56 hours a week and make $48,000. In Hudson, with our wages the way they are, you'd work 48 hours a week, so 8 hours less a week, and make an additional 6,000 to 7,000. So you could work 7 to 8 hours less and make $7,000 to $8,000 more by coming here. Am I wrong? And-
No, it's
Okay.
correct. Yep.
So that's why, like I say, I have nothing against shift differentials for night shift. But I don't understand the 20 cents, and I don't understand,
When you personally went to work full-time at Baldwin and kept working part-time here, what was your logic when you did that, Brandon? What was the reason that you did that for?
It was extra to supplement. I was salaried.
The pay.
Yeah, I was salaried over there, so I was putting in a lot of hours, and
But why didn't you come full-time here as,
there wasn't anything open at the time.
okay, I was just curious.
Yeah, when an opening
I was
came,
trying to understand your logic
Yep.
so that we can see if we can find an answer for what Ray is concerned about. You know? Because that's what people are doing.
right.
They're
and I
making a
I
choice.
absolutely understand the comment about we're working less hours here, because you look at the chart and it says, okay, we're working 36 hours, and our paramedics are only making 37,000 a year. And in New Richmond, they're working 56 hours and they're making almost 48,000 a year. So that's an $11,000 differential, but you're also working 20 hours less a week. When we go to our new plan, which we're going to be implementing here very quickly, correct?
yes,
Okay? They'll be working 48 hours and making, again, $6,000, $7,000 more for working less time.
and the other thing we didn't address in here was step increases as far as going towards retention. So in New Richmond, you'll see that they have a starting of 17, but then they have a maximum of 24. So that gives them kind of a reason to stick around. Right now, we don't have that, so it's another thing that we,
So everybody, the person that gets hired tomorrow makes the same as somebody that's been here 10 years?
yes,
20 years,
Yep.
30 years, same
Whatever it
amount.
is. So, the person that's been working here 20 years looks at that person that just got hired and says, you're making, how do we address that?
that's something that we've been discussing.
Correct. It's something we've been addressing, and we are, the hard thing is, there are some bargaining units, and they're not bargaining units anymore, but some groups of employees that are on a step plan, and there's other groups of employees, including the EMT paramedics, that are not. And so it's not just unique to the EMS, it's citywide, except for a few groups of employees that they do. So if the commission would like the finance committee to look at that, we certainly could do that.
Brandon, correct me if I'm wrong, but we have two problems. One is getting people to come here, and two, to retain them.
Correct.
So are these two separate issues that need to be addressed separately? Because if they come here and they're satisfied with whatever brings them here, we're losing them for reasons. What are the reasons we're losing them? Do they tell you when they leave, it's because X, Y, or Z?
The majority of them lately have been better offers, just financially for them.
Kim left for more money.
Correct.
And where are they going?
Other agencies, and then the most recent one was actually outside of EMS.
Went to work
The
for
most,
the county.
the most recent medic to leave?
Yes.
Yeah, okay. So where are they going?
To the west.
To Lakeview or to Woodbury or?
Some of the bigger systems, Delina, North, Memorial.
Bigger systems?
Yep.
And even some of our part-time paramedics now work over there and fill here part-time, correct, for
Correct.
additional funds.
Correct.
So if you consider the competition to be Minnesota, then you're looking at significantly higher wages than you're paying now.
We are, yes.
So we can't afford that. Can we?
Not without raising the per capita.
Huge amount. So the question gets to be, will this make any difference?
Exactly.
That's a question for you.
And I can't guarantee 100% that it will, but it's an effort moving in that direction.
Yeah, and that's why I said I'm not against shift differential. I mean, we're only, I shouldn't say only, but we're talking about a budget increase of $3,000 a year here to do the shift differential, right?
And that's just for the remainder of this year.
Oh,
And with our
oh,
current
okay.
salary savings, that would be absorbed into our current budget.
Okay, but, so if this is for the remainder of this year, which is what, 4 months? Are we talking about then that this is a difference of what, $12,000 for
Correct.
next year?
Correct.
About 12,000? Okay. So we're talking about $12,000 for this shift differential. I have absolutely no problem with that as a commission member, but I think this has absolutely nothing to do with our attracting people. Something is wrong in our logic here. You know, if you look at what adjoining communities are paying, something is wrong in our logic as to what we're paying. So I would support this, but I don't think it will make any difference in our recruiting.
Or retention?
Or retention. But I believe in shift differential, so.
Yeah, Jim.
Brian, wasn't this more intended to help fill the schedule to get us through to?
Hopefully to hire, though,
Right, help fill the schedule and attract candidates.
to fill the schedule.
Yep.
And a clarification for Ray, we'd said that was $12,000 for next year, but remember, it's just the paramedic portion, the EMT portion would go away January 1st because they go to a different pay plan, they go to hourly. So really, the budget impact for next year is $1,800.
Okay.
And what is their pay, how would their pay change for next year for the EMTs?
EMTs, they're going from a per shift pay plan to an hourly pay plan,
Yeah. So what do we pay per shift now?
between 110 and 117 per shift, is that right?
117 and 130.
So about $120?
Mm-hmm.
So when they go to hourly, what would they go to?
The proposal is $13 per hour
For a 10-hour shift?
for a 12-hour shift.
12-hour shift, okay. So we'd be looking at $160, going from 120 to about 160, is that right? So they would get about a 33% pay increase.
I don't know the percentage, but yeah,
Okay.
it's,
Yeah,
we're
all right.
confident with that.
So we're talking about paramedics getting about a 33% increase.
That'd be the
You're
EMTs.
using strictly numbers, but we gotta remember what we're doing is we're asking them to be here.
To be here,
versus
right,
being on
right,
call.
versus at
That's-
home.
It's not just a
Right.
rate
No,
increase.
I understand, no,
Yeah.
I appreciate that clarification. Yeah, right now they get paid $120 and they can be at home.
Right.
And we're gonna pay them $160 and they have to be on site.
Right,
Okay,
right.
You're
Yeah,
correct,
yeah,
Jim,
yeah,
thanks.
yeah.
All right. So this pay different, so when we're talking about EMTs, next year they wouldn't get a shift differential then? It would just be,
Not at first, that's not in our plan.
see, so where's the logic there? We're having trouble filling evening shifts, but next year we're not gonna pay a shift differential, but this year we are? I don't know.
Well,
I don't know.
We
Okay.
missed that in the process.
and we can relook at that. right?
Okay, so we are talking about a shift differential next year then. All right,
Okay.
all right.
Any other further discussion? Otherwise, we should entertain a motion one way or the other, up or down.
this is for option one, is what option one or two is that we're voting
We're
on?
talking about option 2.
Two, I think.
We're talking option two.
Right. Well, I'll make the motion. I'll move we approve option 2 for the remainder of the year. Is there a second?
I'll second it.
Motion's been made and seconded. Any further discussion? I'd like, in Ray's defense, as we're looking at this and we're looking at budgeting, even if you increase shift differential in your budget for 18, I'd like to know if this works. You know what I mean? When we get to the end of the year, I want to know, did this make any difference? You know what I mean? Before we continue to move forward with stuff that doesn't, just leaving it in place and not doing anything, because we may need to do something different, you know, to get that filled. Please.
So right now, they're saying, we don't think we're getting paid enough,
Correct.
but they're not committing that they're gonna work more because they aren't committing to how much the pay needs to be.
Right.
I agree with Ray, I don't think it's gonna make any difference, but we can give it.
And
a
that's
try.
why I'm willing to give this a shot, but to the extent Tom and Ray, yeah. If we're gonna do this, then we gotta make sure that it works, not just continue the process, you know.
I think number 4 will help out more.
I'm sorry?
Number 4? I think that'll help out more with getting people here.
Well, any further discussion on shift differential for option 2? All those in favor of the motion signify by saying aye. 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 Opposed, like sign. Motion carries. Thank you.
I'd like to thank Brenda for all of her hard work on this. Thanks.
I agree.
Yes.
Okay. Number 4, discuss possible action regarding the remodel. Is there anything else we need with Brenda?
Well, Ward Avenue, we need to know what the numbers are.
Okay, all right. I just wanted to know if I needed to have her here yet, or, okay. Who's got, so Brenda's got the numbers for Ward Avenue? I don't know, I'm asking. I don't know.
I think right now we're just kind of looking at direction how to move forward with this, so.
Yeah, there was a discussion at the Public Safety Committee about when to move forward with Ward Avenue, and the finance director and me said, I think that we need to have an 18 budget approved. We need to have signed contracts from our partners for 2018 before we should have big outflows of resources for Ward Avenue. So that would be my update on Ward. Unless Joyce
So
has
they're
more.
changing the cycle on when we sign the contracts just to get Ward Avenue moved forward?
No.
We always sign the contract at the end, and we aren't going anywhere. What's the logic to that?
Because there's been discussion of funding formula.
Oh, so you don't want to change, you want to sign it before the discussions of the formula, or you want to discuss the formula before we sign it?
I would think we would talk about it as part of the budget process.
Which means now Ward Avenue is put off until basically the end of the year, if I understand that logic.
It's not a finance director decision, that would be a city council decision on when to talk about Ward Avenue.
One of the, part of this is, we don't have any firm numbers on what Ward Avenue is going to cost. We don't know how much Ward Avenue is going to cost. And so what we really want to do is just go ahead so that with getting some more information on how much it's going to cost to work on Ward Avenue. So we're not authorizing the actual changes, we're just trying to get some more information to put into budgets.
So when are you gonna get some information to put it in the budget of what Ward Avenue is gonna cost?
Yeah, I'm not, one of the questions that we've had is, what is the process for doing all of this? And
Right.
we haven't gotten an answer on that. What is the process, Brenda?
If the commission would like us to go back to the Finance Committee and Council and see if they would be interested in moving forward with some kind of RFP, we could do that. I would think that would be the next step in the process.
The town of Hudson was real clear back in February about we wanted that percentage change, the 50-50 deal. And that's what you're saying is your concern of what that cost gonna could be to the city. And that's 50% runs and 50% per capita. And that's the funding formula. And that's what you're concerned about, is what's the funding formula. And that was long before any discussions about whether the ambulance service is staying or going. And that's why the town of Hudson put that down. There was quite a bit of concern about why we had done that motion. But it was like, if we're gonna stay, somehow we think there ought to be some fairness in that per capita sharing cost and of what we're getting. And Ray should have probably been the one that went forward with that, because it was a significant number for them of what they're paying for their service percentage.
Tim,
This is
when
what
did
they were saying.
you, I don't remember that there was any discussion, formal discussion, at least of the 50-50 formula before we started our negotiations with Lakeview. I remember in February.
Correct, not in, oh, no, you're right. Prior to that, Burchell wouldn't entertain it.
Okay.
You know what I mean? He just wouldn't entertain it. And so it was never brought forward again, so he wouldn't even let it he wouldn't let it into finance. So we're just not gonna
it
talk
has
about it.
implications for Hudson, obviously, the city of
Yes.
Hudson. But before we can even, I mean, maybe get a proposal of how much it's gonna cost to remodel Ward Avenue, but don't we have a bigger discussion about the long-term viability of St. Croix EMS? We build the building, I mean, are you guys gonna be able to afford it 5 years from now?
You change the formula that, like we're asking, that's the reason we brought it up.
See, I don't know if the citizens of Hudson are going to be receptive to paying more than they're paying now. So if it doesn't pass,
So you're saying it's the city of Hudson, not necessarily North Hudson, that can't afford it?
well, I don't know, we have to work at the numbers, but I'm not sure if the city of Hudson says, no, we're not going to go with that proposal, then we're back to where we were last summer, talking about, can the city of, or town of Hudson and North Hudson afford this going forward because of your levy limits?
Randy?
I just have a couple comments.
John?
Pardon my casual dress here.
I couldn't see him back.
John Hoggett, Alderman, City of Hudson. I think that the overreaching, much larger problem is an emergency management services issue. We've got a police department, they're pretty happy there. We've got a fire department, it's already been recommended that they should move. We currently have an operational challenge here with EMS space and location. Ward Avenue is an opportunity to either phase in EMS there. However, it's not big enough to have EMS and fire at the same, they've already said that in the study. So how much money should we spend on Ward Avenue in transition to having a potentially fire and EMS facility? To me, it's what's the long-term view of how all this works together, rather than should we just throw some money at Ward Avenue and then wait and see what happens? But we do have your concerns from the contract, and then I think we have a short-term operational opportunity to use Ward Avenue in a way that helps out our service, but doesn't cost us a pile down the road. I think we need to get all these services together at some point and, come up with a future vision rather than, and so to me, it's about spending our money wisely, not trying to, weasel out of your contract or do it in a different way. I think we all have to kind of take the bigger view, because it's not just EMS, it's police and fire too. So I think that's part of the challenge, and nobody really has that concrete direction as to which way we should go.
This was brought up in the Fire Advisory Board meeting, so this isn't, anything you're
And I
privy to.
apologize, I'm not.
No,
up
no,
on
you're
the
not
minutes.
on that board. And
Right.
so I'm gonna tell you something that, and it was Scott that made the comment, and I had to sit and think about it for a minute, and I think he's right. Because we were talking about the Five Oaks proposal and whether we should be looking at going forward with a facility that's multiple for both EMS and fire and designing it. And Scott's comment was, you do that and you're gonna way over design and make too big a facility. You'd probably be better off going to Ward Avenue. You got 300,000 in it. Once the street is done, you gotta pay the other 300,000. The one estimate they got, which was it was a shot in the dark, it isn't a bid, $500,000. The land is worth $1 million, which means you got 1.1 million into it. If you sell it, you're gonna lose 100,000. You're not gonna lose $500,000 by remodeling Ward. And Scott's comment was 5 years from now, when you're finally sitting down, you'll know what does St. Croix EMS look like and what's the fire department gonna look like? Are you looking at full-time fire or not? You know what I mean? He said you'll build a smaller facility for fire and putting them together than if you try to design it today to build them both together.
So my recommendation to you guys would be to design a facility at Ward Avenue that you feel comfortable using.
I agree.
And then everything else is gonna shake out, contracts,
Yeah,
money.
yeah.
You gotta kind of focus on what it's gonna do, so.
I agree with you.
That's my 2 cents.
I agree. But I don't see us moving forward on the level of the city to do any remodeling at this point. I'm not sure if I know exactly what to do to get that to move forward, other than,
Well, I think it goes back to Tom's comment in terms of, you know, we're trying to figure out what the viability of St. Croix EMS is, and now we're talking about a new facility. I mean, I don't have any trouble with doing planning to figure out what it would really cost, but I think until we get the feedback, you know, the council, when they voted, they made a commitment to try and make St. Croix EMS financially self-sustaining. I think that was the motion, right? And right now, I don't see any magic out there. And
I agree with you.
I mean, it looks like the cost of St. Croix EMS, unless we figure out how to either operationally cut costs or bring in a lot more money, and by a lot more money, I mean like $500,000 a year, we're heading towards our per capita cost going anywhere from double to triple what it is right now, right? So the proposals are anywhere from double to triple the cost of the municipalities. So I think until we understand what that looks like, I would be all for doing planning, you know, on what it might look like at the Ward, you know, facility. But I certainly wouldn't want to make a recommendation to the council to say, okay, let's agree that that's our plan of action right now. You know, we've got what, and I lose track of numbers sometimes, an $8 to $10 million fire station that we're looking at, and
That was
I'm,
without land.
yeah. And Brenda, I think when we
It's
talked
without the
about
land.
that at the fire meeting,
It's
what
just
was
a
that gonna
building,
do to
yeah.
our per capita?
For the fire building?
Yeah, to
I
spread it
don't-
over 20 years, I thought that was almost gonna double our per capita there, right?
I think so, yeah.
Yeah, so, I mean, with the new fire station, we're talking about doubling our per capita for the fire. Here, we're talking about doubling or tripling our per capita for EMS. So I absolutely agree with John's comment. I think somehow we need to put the big picture together and say to the communities, is this really what we're talking about?
and the problem that we all have is we can't raise our levy to cover it, even though we think that's a wonderful thing for the community.
I recognize, but if they put it, if we put it together as a package and say, okay, you're going from $14 an hour here to, you know, $30 an hour for this service, and you're going from this to this, and now you've got to come up with an extra $100,000 a year, right? Then you have to say, either I can support this plan or I can't.
I wish it was only 100.
Yeah, I know. I hear you. For you, it's more than that. Yeah, I think for us, it was probably about somewhere between 70 and 100,000 for Troy. And we're only partially covered by this service.
Jim?
To me, the question of Ward Avenue right now is this what we have to have in order to be an operational service?
That was where I was leading to, too.
So that's the, that's, first of all, what does it take for us to be operational the way we want to be? And then we have to figure out, how do we do the financial piece of that?
If we grow the
And
staff.
what steps do we take?
That's your point. If we grow the staff to full-time, can we live full-time in this basement?
No, and we've already outgrown our space with our current staffing.
Just putting a wall up in the bedroom isn't doing that, is it?
No.
That gets us through the end of the year.
Yep.
So I think, that's the first question. Do you want to, what do you want to recommend to the council? Is this the right direction? And I think it's an operational issue.
Since you're part of this ad hoc committee that hasn't been approved, but you're acting as it, have you looked at the long-range viability of St. Croix EMS?
In what respect?
Can it exist financially 3 years from now, 5 years from now?
Can it exist? I think we all know that it's going to require an increase in per capita.
Well, we
Or to
understand that.
exist
I'm
the way we
saying,
want it to be.
I'm asking, we all know the numbers. Brenda gave those to us a long time ago.
Right.
Have you looked at the long-term viability, considering those numbers and our partners?
I'm not quite sure. Yeah, I've looked at it and I say, yeah, everybody's going to be bearing extra costs.
Do you think it's viable in 3 to 5 years based on the numbers?
I don't know how to answer a viability question. Is it viable? Yeah, I think it's possible. I think the question is that what the people want to have?
No, that's not the
And that's-
question I'm asking. I'm asking a simple question, Jim.
No, you're
You're
not.
acting as this committee, and you're taking on responsibilities that we used to have, but you got them. So I'm asking you, based on the numbers that Brenda gave you, do you think that St. Croix EMS is viable 3 years and 5 years from now?
Yes.
Okay, and what's your basis for saying that?
What's your basis for saying it's not?
Well, I think the numbers tell us that it's not viable. We can't do it, but I've already made that argument.
Is that is that an opinion or is that a fact?
It's a fact because we won't be able to afford anything else. We'll have to move Brenda, can you address that again?
At the last commission meeting, we were just said to look at a short-term plan, so I'm just looking at a year right now. But as you recall, in January and the spring, we were looking at, different models and 5 years out. And for the city of Hudson, and we hear this with our partners already, but, some of those different options, we're up against our levy limits. And so that's what the discussion is.
And that's not what he just said. I want some numbers that tell me you cannot, as a city, pay for it.
Because we're up, some of the options were up against our levy limits, I would say yes, then we cannot.
Then you gotta find a way to do it, and it's taking it away. It's the same thing that the town of Hudson, when he said it's 100,000, I know I'm gonna give up snow plowing and road maintenance and everything else. And Tom's saying you can't afford to do it in the same dollar amount, and the answer is no. But how are you gonna afford it, and does the city, he's saying you can't afford to take it from any place else. And that's the only way you're gonna do it as a partner in this.
Well, that's not really what I said.
But it is, that's the way it.
My question
You're telling
was,
me you can't do it any other way.
my question was, has this ad hoc committee considered the long-term viability based on the financial information that we have? 5 years from now, if we have a 50-50 proposal, where will Hudson be at in its mill rate and levy limit?
We're up against, we have a self-imposed levy mill rate of 5.25, and with the models will actually be above that. We'll be at 5.5. And I don't know if I have it
What
with
do you
me,
mean
but
self-imposed?
we have a self-imposed mill rate of 5.25.
The city has decided to not raise it anymore?
That's the City of Hudson goal. Yep.
They're not against, it sounds like you're not against the levy limit, you're just against the
Actually-
self-imposed levy limit from the city.
Mill
Not
rate.
like
You would
the
be
state,
against-
like
She's
the rest
talking
of
about
us
the mill
are.
rate.
No, that's different. She said self-imposed. That's why I'm asking what self-imposed means.
There's two different things. There's self-imposed mill rate. We're up against that.
That the
So we'd
city has
have to raise
decided
that.
you will not raise it any more than that.
But then there's the state-imposed levy limit, and through some of the options, we're up against
So you could
that levy
change
limit.
the self-imposed levy limit to cover.
The council
city could.
the council
Okay.
could choose to change that, yep.
So that
But-
doesn't mean it couldn't be done.
No, but the money we need to support EMS versus the other demands that city departments have is something that needs to be considered, because we won't be able to afford anything else.
And yes, and the City of Hudson has seen that. And just, Tim, yep, we have the self-imposed mill rate, but yes, on some of the options, we are up against our levy limit, our state-imposed levy limit.
So other departments may have to become more efficient or something else to be able to cover. The answer to that is yes. And when we went
Decisions
into
would have
this,
to be
we knew
made.
that. The other municipalities did. John?
Thanks, Brenda. So, a number of years ago, Mayor Burchell put together a 5-year capital improvement plan, and in order to accommodate that, we decided to raise our self-imposed levy limit to 5.25, I believe. Yes, we can change that. So that's one way to add money to our budget. Another way is a referendum. I know people don't necessarily want to do that, but we heard from a lot of people at the last meeting, the one public meeting, that people would be willing to pay more. So we could raise funds, and probably for a capital campaign through like a referendum, like let's build out a Ward Avenue or something like that. Everyone has their different opinions. I'm not on the ad hoc committee. However, when you decide to focus and make it a sustainable entity, then it becomes a sustainable entity. If you decide we can't afford it to pay for it and not do it, then we try to look for other options. So I think the majority of us are looking to say, this is going to be sustainable. How are we going to get it done? So you have to start going back to the base of revenue. I have maintained since I've been elected that, like police and fire, EMS is wonderfully subsidized, but it's always a taxpayer, we'll call it a burden or a service, that you have to pay for it out of your tax dollars. It's awesome that we get money back. The police, when they go out to call 911 at your house, they don't get paid because they came out to your house. Fire, that's a little bit different scenario, but to me, EMS is a service that is provided to the community by community taxpayers and people that ride and use the service. So how does it all work out? Well, it's all going to work out. The numbers you have to look at this business, and I'm saying this because you guys got to start, I think, tilting your view a little bit, saying it's not going to work, to how do we operate and maintain an EMS commission and provide good recommendations to the city council based on this being a business. If it craps out, it craps out, but I don't think that's what's happening here. I think you're seeing a lot of energy going into it to make it viable. So I really would recommend to start just making decisions that you could pass on as recommendations to council and other places, like what are we going to do with Ward Avenue? I think you should seriously consider building it out, and what's that going to take? You know, the money will come from somewhere or it won't, but you still got to go in that direction. So I would encourage you to kind of move forward in that manner.
John, you're saying the money will come from somewhere or it won't. We don't want to build a facility based on that.
Well, you say 5 years, I'd say.
Let me finish. I'd listen to you. Let me finish. What I talked about with Jim is that we have to make some extreme choices, and it's all centered around EMS. I'm not saying that it's not an essential service. It is. I agree. But it's going to cost, in terms of what we have to raise to pay for it, but it's also going to cost in terms of what we have to deny or take away from other departments. And that's what I was asking Jim, is if you thought about that part. I don't think anybody really has, because right now it's just abstract, it's numbers. But
it's
it
a
will
direction.
it will get to the point where we have to actually say, well, you're not gonna get any more police, or you're not gonna get this, you're not gonna get that, and that's what I'm asking, you know, have you thought about that?
I've sat and listened to your finance committee, and that happens every year.
This is gonna be
All the
much,
time.
this is gonna be much different than that.
Yeah.
We all know that the amount that's
But it
gonna
will
be
have an
paid.
effect, and I don't think
Absolutely
anybody
will.
hasn't realized that, Tom.
Right.
Well,
So decisions have to be made, that's why we're in these positions, and that's why you gotta make the, you know,
Right.
the choices down the road. 5 years is a long time, and even 7 years or 10 years, Ward Avenue could be extremely highly utilized in an operational model in 5 years, for the period of 5 years. Even if at end of 5, it were to transfer somewhere else, which I highly doubt, it still gets used. Right now, it's just sitting there not doing anything. So I say let's get a 1, 2, 3-year phased-in model to do what happens with Ward. Can we offset an ambulance up there, maybe one, or, you know, that kind of thing. So that's what I'm talking about.
My concern also is, I sit on the fire advisory board, and leaving St. Croix EMS here doesn't help the fire commission. They're severely short of space too, and leaving them in that building doesn't do us any good for the next 3 to 5 years.
So it makes sense to send it out to get how much it's gonna cost to remodel.
I would recommend.
I agree, but I appreciate all John's comment. The only question I would pose, and I'll pose it back to the city council, and maybe they can respond back, is when our work, which was directed by the city council to look at a non-taxpayer funded proposal, right, which was with Lakeview. They said, okay, look into that and see whether that's viable or not. We looked into it, we were probably 80% towards the contract. It was voted down by the council, said basically, let's suspend all those efforts and let's put together an ad hoc committee to see whether we can have a financially sustainable municipal ambulance service. Now, if we go through this process and we find out that, yeah, we're gonna pay 2 to 3 times more in 5 years for this ambulance service than we do now, is that financially sustainable? Sure, we're all gonna have to come up with the money someplace. We can't not have an ambulance service, right?
That's correct.
Is that what the council meant? You know, that's fine, and I hear what Jim's saying, is what's financially sustainable? You know, if the city of Hudson decides, okay, we're paying $190,000 now, and if we go to a 50-50 system, we're gonna pay $470,000 a year, that's financially sustainable in municipal support, right? So, I mean, are we gonna go through this process and try and look at all of the things that the ad hoc committee has suggested, which they've got a great list, and I applaud Jim for going, I've worked with Jim in the town of Troy when he was a town of Troy resident. He's very probing in terms of what he does and, you know, looking at these different options. But, I mean, we've got to find, if we don't find the options that either cut the cost of the service or bring an extra $500,000 to $600,000 a year in, are we just gonna move forward anyway? You know, and that's my problem.
I hear your concern. Nothing that I've heard brought up either at the council meeting where the change was made for the ad hoc committee or in any other the discussions during the sale to Lakeview. I don't think we should do it today, but if in 3 years, let's say, we find that this is financially more than we as the partners in this facility isn't working out and it's gonna be more than we can afford, then we ought to do an RFP. There are other facilities that were willing to purchase this facility, this operation, that would have run it similar to what we're doing and not the way it was. And that was the big objection from the employees, was the way the system was gonna run. So at that point, we work with the employees, we put the RFP out, and we look at what it's gonna cost all the municipalities to have a service with some other agency running it. And at that point, we look at it. But I don't think we should do that right away, right now. We were given a directive to try to work together and make it work. And so we ought to move forward with Ward, get a bid to do Ward, and make a decision on one way or the other, up or down, and so that we can get the service to be functional, you know, and work efficiently. Because that's the only way you're going to get your dollars to work out. And maybe in fact, part of what the concern is the conditions that we have in the building. I don't know. You know, I don't like where I'm staying.
Yeah, that's been brought up. Yep,
Is it?
definitely.
Well,
Okay.
yeah.
Yeah, this isn't something I'd recommend tomorrow to
And-
go
and-
do an RFP to sell it operation now.
Right. Based on the numbers that have been put out, within 2 years, the cost of this will double. The municipal cost of running this will double.
Unless we find alternatives, and
Right.
that's what the ad hoc committee was looking at.
And then,
And so at the end of the day, if you get 2, 3 years from now and you find out that you haven't been able to reduce cost, you haven't been able to fine tune this, and we're ready to throw in the towel, and the service is ready to throw in the towel, then we do that, but not before that, I don't think. Any other comments?
and I appreciate your comments, Tim. And I would like the city council at least to give some direction back to us in terms of if this is where we're heading, double and tripling the cost of this, is the city council open to, in the next couple of years, revisiting whether this should be a municipal service or not? If not, then all we need to do is figure out how do we most cost-effectively run the service we have? And don't think about whether it's financially sustainable or not, right? Just make it as cost-effective as we can.
Well, that also fits into the city model, because Thomas said that it's gonna be something that the city can't financially.
Well, the city's gonna have to make significant choices, gonna have to raise taxes,
Yeah.
and that'll be
All I
up to
can
the
say to
council.
you is, thank your lucky stars you can. We can't.
I don't think the citizens look upon taxes being raised as thanking their lucky stars.
No. As a
I
municipality with
understand.
budgeting, we
I-
can't raise our taxes,
I got
period.
that, I
But
got that part of it.
we probably had 20 or 30 people come to the mic through citizen input saying they wanted to raise taxes,
Right.
so, yeah.
So anyway,
So first thing we've got is, do you want to have a motion about getting bids to remodel, or at
Yes.
least I
Right.
don't know if bids is the right
I
word.
agree, I agree.
Some sort of an idea of what it's going to cost.
yes.
Okay, I'll make that motion.
Yeah. Okay, I'll second the motion to get a bid to look at options for remodeling.
Any further discussion?
There's plans and stuff, or do we have plans, or is just, this is I mean,
Josh had somebody come and look at it.
You know, I think it was it Jim, who looked at that, Josh? Like
What are you doing, a
2
jig
years
over
ago.
there?
kidding me.
Was it
It was on
David,
vibrate, so I couldn't jab my
David
pocket.
Ray that did the numbers?
Sorry for that.
David Gray did a set of numbers, and I got a friend that's in the construction that just built the new Pierce County Jail. And he came up and looked at it and just put some quick rough numbers together.
Okay. Well, we'll
So
get
we need
more.
to get a bid, I
Yeah.
agree. Whoever the city would
Estimate.
use estimates
Yeah.
of doing something. Any further discussion? All those in favor of the motion signify by saying aye. Aye, opposed, like sign, motion carries. Number 5, discussion possible action regarding the remodeling of the bedroom in City Hall and purchase of the stove.
So the recommendation that came down from public safety was to wall off a bedroom and then purchase a stove that would be placed on second floor, not to exceed the cost of $5,000. Since that meeting, we've had some discussions, and we feel that we could potentially free up 2 spaces downstairs by moving Josh and my office into the conference room.
And
That
get
would
rid of
be-
the conference room.
Yeah, and then that would be no remodeling cost for that bedroom.
So there is no need to have a remodel?
If we did that, we wouldn't have to remodel the bedrooms, no. That would give us enough sleeping quarters.
Where-
We'd still need to do something for the kitchen facilities. There's still no place to prepare meals.
The employees come and sit in that conference room, where would they sit when they're not on call then in the future?
They'd be in that back
In their
lounge
bedroom,
area.
sit in the bedroom in the lounge area?
Yep. And we'd have to relocate the big table and that, but we feel that we'd be able to do that as a short-term fix.
So Brandon, what you're saying is the remodel is not needed as long as you can move the kitchen facilities? Is that,
Yeah, we would have to have something in place for that.
Stove.
Yep.
and where are you proposing?
Second floor is what we were told was possibly an option in the break room across the hall here. There was some logistics with
The security, isn't it?
access, yeah.
So how, Brenda, how would that work?
We'd have to have somebody come in and look. At first, we thought that you could just plug it in the wall outlet, but
220.
yeah. But
For starters.
There'd have to be some rewiring, so it might be cost prohibitive to put it in that break room. And there's some security concerns that we would have to address as part of that bid process. Or that quote. We wouldn't have to bid it, but.
Could you put it in the garage? Just a simple question. You're gonna wire, it'd probably be easier to wire 220 out to that garage than anywhere. Because you just want a place to
Yeah,
cook
just
and
a
eat.
place for them to prepare their meals.
Yeah.
It's heated,
We could look at that,
the garage is heated.
yeah.
Well, that's a question, I mean,
Yep,
Yeah.
in winter time.
Just a thought. Rather than trying to shove it into some other corner. Because you're not looking to sit down and eat in that area. You
and I
just-
had initially talked to David about that, possibly, putting it out there and maybe walling it off. And there were some issues with the way the ventilation is set up in there.
So you'd have to
So-
probably ventilate it as well as put it in.
Yeah, relocating the current ventilation is what the issue was at that point.
And I would make sure that if we're agreeing to this, you're probably gonna take it out the minute we'd move toward.
More than likely, yeah.
Yeah, because I think just for the city, it would be a good thing not to leave it out there.
Yeah,
Well, and move the stove to Ward Avenue, and
Yeah,
you can have
yeah.
to cook there too, I mean.
Right, yeah,
it's a-
so it's not a loss of purchase.
right.
So Brenda, you said the option of having it on this floor is that's not workable.
It doesn't, once we started looking at it more and more, it just doesn't seem like, it just seems like it'll be cost prohibitive to do the security and to do the rewiring.
So Brandon, do you want to look into if you can put it out there or not?
Well, yeah, we can further look into it. It sounded like it was gonna be a little bit more work to do that. I don't know.
But if you're
cost-wise what it's
avoiding the
gonna be.
$5,000 cost on, what's it gonna cost you?
Yeah.
$800 to put in a hood?
Yeah, I'm not quite sure exactly
The wire?
what it would cost to do
You,
that.
you will have to ventilate it. I didn't realize that, but you do have to ventilate a stove for code, one way or the other.
So,
There currently is facilities over there they can use. It works okay this time of year, but come, January, December, when it's below freezing, carrying food back and forth across the street, kinda. That was one of the concerns.
There was a while ago, we discussed that there was an issue with mold and stuff downstairs. Has that been remediated?
There was some mold abatement done a year ago or 2 years ago now. They removed a couple of panels and then they put the same trim back on. I don't know if there's been any retesting done, but there has been complaints of,
Well,
If you guys are gonna move in there, I'd want that room retested.
the conference
Sorry.
room.
Yes, that's where it was
That, yeah,
huge.
that was where they replaced the carpet.
That's gonna be your office, I'd like to have that room retested.
Well, I just,
for you.
from
So-
talking to different.
do we want to just
staff,
make a motion for a certain amount of dollar value and let Brandon look at the options?
I agree, because I don't wanna drag this on, or the next thing you know, it's gonna be December before you get it done, and that's not the
Right.
intent.
Right.
What do you think you need?
I think the 5,000 was reasonable.
And you should be able to do it for less than that.
Yeah.
Okay. I would move we approve moving forward with the remodeling for whatever purpose for the stove and bedrooms for not more than $5,000.
Is there money in the budget for that?
There's, in the 2017 budget, there's salary savings that could be moved.
So it would have to be moved. Would we have to recommend that, or who? Or does finance
No.
have to do it?
I'll second the motion before we discuss.
Yes, thank you.
You would not have to approve the budget amendment, it would just be a budget adjustment.
Can you move money without anything? Approved?
Why don't we make it as part of the motion, and then we're covered?
Oh, okay. I would move that the money be moved from salaries to
Remodeling?
Remodeling cost.
I'll accept that amendment.
Okay. Any further discussion?
I think we should support this because there was a comment made earlier that this was actually a better, more effective retention thing than the salary increase.
I agree with you.
Well, not more than the salary increase, but it's a big part of why people don't wanna pick up call time at night, because they don't wanna sleep in a basement.
I'll call for the question.
All in favor of the motion signify by saying aye.
Aye.
Aye. Opposed, like sign. Motion carries. Thank you very much. Number 6, discussion and possible action purchase of the radios for compliance with the new dispatch system that goes live September 7th, 2017.
All right, I have two quotes here. One's from Rossbach Communications in the amount of $14,655.15. And the second one is from Professional Wireless in the amount of $16,260. Looking for approval to go with the Rossbach quote to replace the
Have you
radios.
verified that that's still a valid quote since we're past the 15 days from the August 8th date that it was quoted at?
I have not, since the 15 days are up.
So do we have any option, Brandon, other than update our system?
No, and it's something that we would have been looking to do anyway. Our radios in the trucks
But
are,
I mean, with the new dispatch system at St. Croix County, is this is something we need to do?
yeah, our current radios don't provide the signaling capability that they're adding on.
I move that the commission recommend the purchase of the radios as detailed in the Rossbach Communications proposal for $14,655.15.
I'll second that. What's the plan if it goes up?
Let's see. We have, we just got the update, 15,484.01. Still below the Professional Wireless.
15,000.
It went up?
Yep,
Yeah, that was what I was afraid of. 15,400.
15,484.01.
Would this, Brenda, would this come out of reallocation of employee wages?
This was in,
Yep.
Or is there
Capital.
money in
I
there?
can actually
It's
address that
capital
one.
dollars.
So yeah, this is we had a capital savings on the heart monitors.
Oh, that's right. Okay.
So,
Yeah, gotcha.
we still should have room in capital.
That's right, yeah, I think you even said that.
Yep.
I'll change my motion to a number not to exceed 16,000.
Okay. I'll second that. Any further discussion on the radios? All in favor of the motion signify by saying aye.
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 Opposed, like sign, motion carries. Thank you for getting that, Josh. Discussion possible action of RFP for billing company.
So, we're looking to send out an RFP notice to the current billing company that we're just gonna look at what else is available. Our contract is, coming up in June, so we have to give them 6 months' notice.
Okay,
So I just want to get that kind of on your radar, that we would like to look out there and see what else is available to us.
What do they charge? I know it's based on how much the account is aging, but what is it generally?
What's our average check a month, Joanne, that you write back to them? About
$7,000.
$7,000 a month?
So 80
And
to
I-
90,000 a year?
Correct.
And I think we were paying 150 with the other agency, if I remember, a year. So just as I'm trying to figure
The rate
out,
is at
that's why we
7%.
switched originally. So what do we think we might get by doing an RFP? What's out there?
You know, I'm not really sure what else is out there, but it's been quite a few
Quite a
years
few
we've been with
years.
them.
Yeah,
So, I
Eric
think it-
was chief when we did
Yeah, I
that.
think it's healthy to just look and
Okay.
see what else
Good
is
idea.
available to us.
That's a good idea. Excellent.
I move that the commission recommend that the EMS chief work on an RFP to evaluate options for billing EMS services.
Second. Any further discussion?
Yeah, can I get you to add in there that we notice the current billing company, so we get adequate notice? We don't-
6-month
Yeah,
notice.
I want to make sure we don't lose out on that 6 months.
Brandon, is there any information that you would want from a billing company that you're not currently getting?
Oh, that's a good question.
Yeah, a lot of that data that you've requested, there's other agencies that are able to get some of that more readily.
Why
So I
don't we-
kind of want to see what they have to offer on
Why
that.
don't- Yeah, make that part of the RFP,
Yep.
whatever data that
I agree,
you
that's a
want to
good,
get.
good point,
Okay.
Tom.
And if there's anything that you as a commission feels pertinent for data, let me know so I can build that in.
You need more suggestions, huh?
Yep.
Well,
It seems like you're
Brandon,
getting a
what
lot.
data would help make your job easier in answering the questions that we pose to you? What would you want that you can't get?
Most of the stuff that you've addressed, call times and all that, which was previously available in the old system. This new system just doesn't have the functionality yet. The other thing is having ability to look at accounts. We frequently get phone calls downstairs or people will walk in attempts to take care of their bill and we don't have access to any of those accounts. So it'd be nice to be able to do that for the customer service side of things.
That'll be all part of your RFP of what's available
Right.
when you get the service?
Yeah, we'd like to be able to, view the statement, so when somebody calls with a question or concern, we can actually address it rather than sending it to some off-site company that's not familiar with the ins and outs of the call.
Are you willing to add that to your motion, Ray, that the 6-month notice is going out
Yes.
to the billing? And I'll agree to that second. Okay, any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Aye, opposed, like sign, motion carries. Future agenda items. You gonna want RFP on there yet? No? That's probably too quick.
Actually, we have a draft one that might need some tweaking. We might be able to present that at the next meeting.
Well, let me ask, is it still the 18th?
Yes.
18th at 7 a.m.? Okay,
7 or 7:30?
Well,
we talked about 7,
we had talked about 7, but
so you don't need it any earlier?
No, no.
7:30 is okay?
Thursdays that
Okay, 7:30 is fine?
And it would be helpful if we
That-
had a
is that the 18th?
regular meeting date. So that could probably be on the future agenda, would be setting a regular meeting date and time.
Well, some of that is only because we had so many things coming forward. We were meeting on a monthly basis, on a regular basis, but then all of a sudden it was all this other stuff that was coming forward. We got out of a sequence of a regular meeting.
What did you have for your regular meeting?
It was like the
it's like the third
third,
Tuesday,
third,
Wednesday,
third
yeah.
Wednesday, I think, is what we were doing.
Third Wednesday?
I think so.
I think it'd be beneficial to set it following a council meeting week, so that way we have it in between. If we
Oh,
have anything to address, we can
good
get it on the
point.
next agenda.
It's a good point. So that ought to be on the discussion for
Yep,
the future
okay.
agenda items. By the 18th, will we have numbers for budget? So we should do budget discussions.
Bylaws.
Bylaws, okay?
I'll rewrite that one. Brandon, maybe we can get together and go over some of the other ones that need to be changed.
The Ward Avenue bid, just in case, just so that if there's a bid in, the remodeling for City Hall, just for a report on where we at with it. the radio purchase? Because by then that's the day after you should have it implemented.
I'll let you know how they're working.
Okay. Anything else? Ambulance rate increase, is that gonna be in place by then? Do we need to discuss it any further?
I was making the assumption it would be January 1st.
Oh, okay. Oh, I know what we need to know. If you're gonna propose a rate for the non-municipality rate, what's that gonna be? Anything else that anybody else can think of that we need on their agenda?
I think it would be interesting to know and work with our Hudson Hospital contact, I can't remember the gentleman's. Doug, yeah, work with Doug
Johnson.
in terms of, in 2016, how many interfacility transfers were there from the Hudson Hospital? And how many did we do of those interfacility runs?
Oh.
Just to give us a sense of, we're making this projection that we're gonna have a 10% increase based on interfacility runs. If we knew last year how many there
We did
were.
406 last year is what we did
From total
Hudson.
for all of them?
from Hudson. We provided
We
406.
transfer other than Hudson?
We have. We've done transfers out of Westfields in Richmond and out of Baldwin.
Oh, wow, okay.
So what we're missing is how many were
How
there.
many were there total? Yeah.
Okay.
So that would help us give some clarity to our
10%,
projections, right?
Right.
okay.
So the run call, the 50/50 thing we've talked about, that's just gone now. I mean,
No, I think we need an answer from the council on the direction of that. I think we want it on our agenda to talk about the 50/50 run cost and whether the city is willing to.
Not even phrase it that way, in terms of, just phrase it in terms of a discussion about how
Model for 2018.
how to more
Equitable?
equitably share EMS costs. Plan to equitably share EMS costs or something, I don't know.
And like I indicated to Jim, and I understand where Burchell never wanted to discuss it, because in 2011 was when we did it with the fire contract, and it was such a hit to the city at that time that Burchell asked us to please let the city absorb it over 2 years. And we said, yeah, we can let you do that. And so those discussions along Ray's thought here is that may need to happen in those discussions of how hard is that hit, Tom? And how can you fund it is what your concern is, and which is valid. It is.
We were discussing this 10 years ago.
Yeah.
Yeah, I mean, this is.
Yeah, we wanted it right away.
Yeah, this is not a new topic. What's
No.
really raised its head is
And just for
kind of the
you
exploding
to know,
cost here, yeah.
what we realized, the clerk and I went back through the fire contract, and that's when all that data in the fire contract got changed when we went to the run average change in 2011. That was when and we were so busy with the other municipalities, happy that changed. We never looked at the verbiage in the contract to see that it got changed beyond that.
Yeah.
And
Tim,
so Burchell had gotten that changed.
since this isn't on the agenda, probably we shouldn't be.
Yeah, probably shouldn't discuss it, but that's where it came from. Anything else for next meeting? I move we adjourn.
Second.
Motion been made and seconded. All in favor, say aye.
Aye.
Aye. We're done. Thank you very much.